That's because I can show clearly that just taking the essentials alone positively affects blood sugar and actually all components of the cholesterol. Total cholesterol, triglycerides, HDL, LDL are all positively benefited. Blood sugar is less and appetite is decreased. People do better. You know, you add the detox system to that and you've got an extra benefit as well, and people feel better very good and very quickly. So we have great medical benefits, and dozens and dozens of people have changed their lives and got off a lot of different medicines and feel better as a result of that. As much as we'd like to, every time you give somebody a medicine, you don't usually make them feel good. Usually there's some side effects to overcome, and that's one of the things that we can do by lessening the number of medicines people have to take, and I've had that great experience.
You mentioned in Dr. Richard, about the blood is certainly significant. Have you had any responses from a diabetic standpoint with the metabolic?
Obviously, the weight loss is the biggest issue with diabetics, but there's something unique about Qivana's metabolic program because it focuses on the right amount of protein, which is basically absent in every other dietary program out there. Too much protein is not good, too little protein is not good, but the right amount of protein is everything. And our diabetics do phenomenally well. I mean, everything from decreasing the protein in their urine caused by kidney damage to lowering their blood sugar and all of the other benefits that go along with that. Because once you control that, you feel good. Your body's energy level increases. All of the things that can happen metabolically in the body improve simply by bringing your sugar under control. And so far, in my 35 years experience as a physician, the metabolic program, the weight management and lifestyle program have been the single best tool that I have had that will help people without causing harm. You know, insulin is not a great thing for the human body when it's external. It does a whole bunch of things that are bad, and we would prefer not to do it. When you have no other choices, it saves lives. But prior to that time, we can do great things simply by using the metabolic system supplemented by the core essentials.
On the same note there, Dr. Richard, you had said you're getting some results between both programs, the core and the metabolic, and getting people off of some of the medication. A lot of questions I get in the field, are there any contraindicators of taking the essentials while you're still on some pharmaceuticals? And when do you make the adjustment? Like you've seen some results, so you've been able to get them off of whatever prescription. How does that work? Do you reduce the prescription and see the results? Comment on that, if you would, please.
Well, let me explain. Complicated subject and a lot of different components to that, and I'll try to be as brief as I can, but always there's people that can't take almost anything you have. You know, there's some people that can't tolerate something. These are real products with real components in it, phytonutrients that actually have benefit in the body and have an effect that goes on in the human body, and so there's always going to be somebody that has problems. And the issues are those people really will have to either decrease doses or not be able to take the product at all. There's going to be people that have a number of medications that are being treated for complex diseases that really need to talk to their doctor. You've got physicians that know what they're doing in their health care, and they need to make decisions as to whether or not something is okay for you to take. If you're on Coumadin, you've got to have your Coumadin checked. You know, you've got to have your blood test checked. If you are on any product that you are adding to a treatment regimen, you need to discuss that with your doctor and make sure. From my standpoint, when I have a diabetic that is taking the core system and the metabolic system and they begin to lose weight, their sugars are going to go down, and I give them instructions ahead of time as to what to do. If your sugar gets to here, you cut your insulin at this amount. If your sugar gets to here, you stop some of your oral agents. And it's a straightforward, easy plan that a doctor can do with their patient. Some of it is straightforward common sense. If your sugar is too low, you got to get off some of your medicines. If your blood pressure is too low, you got to get off some of your medicines. And I instruct patients on how to make those decisions, because some medicines cannot be stopped abruptly. They have to be weaned off, especially high blood pressure medicines have to be slowly and thoughtfully changed, usually under the guidance of your doctor. But truthfully, you should be able to give a patient all of the instructions they would need to be able to make these decisions as they improve metabolically and physically in their weight management program and using the natural products that we
Now, in reference to that same type of situation, Doc, what about the timing of taking products? I mean, you know, we hear probiotic on an empty stomach. Would you kind of comment between the essentials and detox when good timing might be?
I will. And for the first thing you mentioned, the probiotics really have a special covering, a tropospheric covering, which protects the body from the beadlet, from the acid environment of the stomach. And so you really want to take it on an empty stomach about 30 minutes before a meal so that it can pass through the stomach quickly and into the small intestine where it can begin to dissolve, especially as it gets towards the large intestine. The core detox system is really for removing heavy metals from the foods that you take in your diet. So part of the benefit would be to take it with meals. And so I would choose to take it with the two biggest meals of the day. Typically, right at the start of the meal or at the middle of the meal wouldn't matter too much because it's going to mix fairly well with the food that you take. Because one component of the detox removes heavy metals, radioactive elements, and toxins such as free radicals from the food that you eat before it is absorbed. It binds it in the intestine and eliminates it in the stool. And then another component is absorbed through the wall of the intestine into the bloodstream. That is the modified citrus pectin, which binds to the heavy metals inside the body and slowly and successfully makes a complex with these heavy metals and removes them through the kidneys. This takes time, but that part could be done any time during the day, but the overall benefit would best be achieved by taking them with meals to get that great benefit of stopping the absorption of heavy metals that you're taking through the diet. The core essentials, if you want to feel good, take them anytime you want to. There's hardly a time of the day that you couldn't find the benefit of something that makes you feel good and increases your mental alertness and gives you more energy. So have at it. Take them 2 or 3 times a day if you want to. That's what I do. So the core essentials and the detox have some leeway in what you do. You're not going to hurt yourself if you just take them anytime during the day, but you can get a special added benefit if you time them as I was describing to you.